Welcome to the Pain and Inflammation video series. I'm Terry Shockley, Vice President of Sales for Anabolic Laboratories. We've been supplying quality nutritional products to doctors for over 85 years. I hope you find these videos helpful, and we look forward to doing business with you. I'm once again joined by Dr. David Seaman and Dr. Russ Antico. Welcome back, gentlemen.
Thanks. Thanks, Terry.
Our topic today is acute injury recovery using proteolytic enzymes, the primary ingredients in Anabolic's all-natural product, Xymane. Dr. Antico, let's start with you. In our first video, if you'll recall, we talked about acute pain and the use of salazane or white willow bark to treat that. Today, I'd like to know, how do you treat patients that come in, they have an injury, and basically all they want to do is heal about as quick as they can?
Well, yeah, it's important. I use Xymane to try to initiate a rapid and a positive healing response. What's crucial then is to control the initial inflammatory response, which oftentimes can spiral out of control and actually hinder the overall healing process. So we use the Xymane, which contains the proteolytic enzymes, and those supplements, along with my manual therapies, I find to be very effective in, again, initiating that positive response right away.
Okay, so getting on top of that inflammation is key.
It is, absolutely.
Okay. Dr. Seaman, this question is for you. What are proteolytic enzymes, and how do they help with healing?
They're natural substances. For example, bromelain comes from pineapple, papain comes from papaya, trypsin and chymotrypsin are pancreatic enzymes, and they have many different anti-inflammatory benefits. For example, they can antagonize prostaglandins, cytokines, bradykinin, and then they have unique effects. An example would be the ability to activate plasmin, which degrades fibrin, and fibrin is the initiator of the fibrous tissue deposition process. So immediately post-injury, as Russ said before, the acute inflammatory process can be excessive, and enzymes can help get a handle on it and calm it down.
I think what our audience would be interested in is, what does the research say about proteolytic enzymes?
There's a great study that looked at ankle sprains. Half the group got enzymes, half the group got placebo. The group that got placebo took them 4 days to get back to work and only 2 days for those taking the enzymes. When it comes to exercise, those taking the placebo, 15 days to get back to work. Those taking the enzymes, just 10 days.
Wow, that's pretty significant.
Substantial.
Sure.
Okay, all right. You guys are the doctors. How do you use Xymane in an everyday practice?
The best way to look at it would be from the acute sprain perspective, and that could be any joint muscle. And also, when you look at the spine, you'll be thinking about acute disc herniations because of the intense inflammatory process taking place then. The important thing with the enzymes is to take them on an empty stomach between meals, upon arising, before bed. And that way you get the enzymes absorbed into circulation, into the area of inflammation.
Yeah, as a chiropractor, acute lower back pain, certainly disc herniations is a condition I find to be very beneficial with the Xymane. The tendinitis, bursitis is also a big inflammatory component, so very beneficial there as well. I typically recommend the Xymane with the dosages of 4 in the morning, 2 in the afternoon, 2 in the evening, again, ideally on an empty stomach. We'll do that for no less than 6 days and no more than about 12 days or so, again, with the omega-3 fatty acids, and you want to shoot for the fish oil around 3 grams per day. Salazane can certainly be used for pain control. That, along with my manual therapies, typically see a real nice reduction in inflammation, and again, you're getting that patient off to a real nice start.
Dr. Antico, there's other proteolytic enzyme products on the market. Why Xymane?
Good question, Terry. Prior to bringing that into my practice, I did a lot of research with regards to the supplements available and also the companies that were manufacturing those supplements. And once I saw the manufacturing standards, the research, and the quality control that goes into anabolic, my decision was pretty much made. I trust David and the research he puts forth. All this research, by the way, is available on PubMed, but after working with Anabolic for so long and seeing the results, I'm very confident in the products that they produce. In addition, I actually had the opportunity to spend a whole day in the manufacturing facility, and again, I saw firsthand the quality control, the manufacturing standards, and even the research that goes into this, and my confidence level has never been higher.
So quality, reputation, and trust is big for you.
Absolutely, as well as results.
Can you walk us through a case study where you had success with using Xymane with your standard treatments?
Absolutely. Just recently, Tony, he's a park ranger in my town. His office actually happens to be just a couple doors down from me. He presented with the symptoms consistent with an acute disc herniation in the lumbar spine. Sure enough, it was confirmed on MRI, and we started our manual therapies, and in addition to the manual therapies, we initiated the acute protocol with the Xymane, the omega-3, and the Salazane for pain. After about 2 days or so, we had a pretty significant decrease in pain. Tony commented that he was able to sleep much better. And by week's end, he was back to work with still some pain, but he was able to do most of what he had to do without a significant increase in any of his pain.
Once again, I want to thank you guys today for your time and insights on acute injury recovery and the use of Xymane. If you would like to learn more about Xymane and acute injury recovery, please visit us at www.xymane.com. For any technical questions you may have, please call the number on your screen.